Good afternoon to everybody in here. Uh, my name is Ricardo Ramirez, and I'm currently a respiratory care practitioner that happens to practice in the state of Illinois. I currently work for Rush University Medical Center, and I recently acquired my credential on acute critical care specialist. So today, you guys, I'll be talking about reducing COPD deaths in adults. And the reason I want to talk about this topic, it's because I think I've taken care of multiple patients that are diagnosed with COPD, but at the same time, majority of these patients do not understand how to follow a COPD action plan due to their level of literacy and the knowledge and understanding about their own disease. So today, we'll be talking about this main bullet points pretty much. So this presentation is going to contain information about the definition of COPD. It's also going to have COPD statistics that's in adults. It's also going to talk about COPD stakeholders in Illinois. We'll also talk about the Respiratory Health Association, and this association is actually in the state of Illinois, and you know, the education they provide and the things they advocate for here in the state of Illinois. We'll also be talking about the literacy levels in Cook County. And the reason I'm going to talk about that is because I actually currently reside in Cook County. As well, we're talking about health literacy and health outcomes in COPD patients. Alright, so let's just dive right into it. And we're going to start primarily with the definition of COPD. So what is COPD? COPD stands for chronic obstructive pulmonary disease. So this definition that I will provide to you guys, actually, I got it from the book of Fundamentals of Respiratory Care. This is actually a book that I used when I was going to school 3 years ago. So the definition that is stated on this book, it says that COPD is a preventable and treatable disease that it's characterized by airflow limitations that is not fully reversible. So this disease actually could be acquired by exposure to noxious particles or gases, because of cigarette smoking, because of smoke, stuff like that. So primarily what happens is that all of these particles and smoke that goes into your lungs causes an inflammatory response to your lungs. So by doing so, it can create this disease in the long run, in the long term, pretty much. So there's actually, COPD is considered one of the obstructive disease in pulmonary diseases as well, because there's only five. The five of them, one of them is asthma, the other one is COPD, and COPD is actually divided in two diseases. One of them is known as chronic bronchitis, the other one's called as emphysema. We also have cystic fibrosis patients as well, and then this will be actually the five diseases that it's divided into. So yes, so let's also talk a little bit about the statistics as well. So COPD statistics. So COPD is the fourth leading cause of death in the U.S. Imagine that. So according to the American Lung Association, COPD is the fourth leading cause of death in the U.S. That's actually, I consider that actually being pretty crazy, considering, you know, that, you know, not a lot of people might not be aware what causes COPD. Not a lot of people that smoke, that vape, you know, having particles in that go into your lungs due to smoking actually, you know, can be really, really bad for you. So it's something to look out for, you know, especially if you are somebody that has you know, that is a smoker, or it's starting to smoke, or has smoked for like multiple years and stuff like that. It's really important for you to know this information, I think. So in the U.S., over 16 million Americans have been diagnosed with COPD. Excuse me. So this information was actually provided by the Respiratory Health Association, which is one of the associations located here in Illinois. But I think that's actually pretty crazy statistics right there. Also, 8 in 10 COPD deaths are caused by smoking. So what does that information tells me is that majority of the people that are diagnosed with COPD are current smokers or smoked in the past. And so the severity of COPD, you know, it can be divided on like how many years you smoked, for how long you smoke, and also how many packs per year you smoked. So those are like important things that we look out for, that we always ask our patients, for how long they smoke and if they're currently still smoking as well. The other thing is that there's a statistics by Healthy People 2030 that states that 105.6 deaths per 100,000 adults. It's like the goal that we are reaching for, like as a nation, right? That's the goal that we're reaching. They're trying to reach as a nation. But in the state, actually, in the state of Illinois, we're like barely reaching that goal, because the statistics for that, it's actually 107. So we are barely reaching that goal, 107. So we're barely there to what the nationwide goal is. All right. We're gonna also be talking about COPD stakeholders in the state of Illinois. So I mentioned one of them before, which was the Respiratory Health Association, and the other one that I will be talking about today is the Illinois Department of Public Health. So the Illinois Department of Public Health and the Respiratory Health Association, they both work together and develop a state plan. And then this state plan is like a COPD action plan, pretty much. And it's like this plan was actually started in Illinois. So this plan serves as a guideline to reduce morbidity and mortality in patients with COPD and improving their quality of life in them. So morbidity means COPD can cause some other diseases, right? As I mentioned before, chronic bronchitis, emphysema, and mortality is just like the amount of deaths that we have within COPD patients. And the end goal of this plan is to pretty much reduce a couple of things: reduce mortality on COPD patients, reduce readmission of COPD patients, and also educate patients on their own disease, right? So they have a well understanding of what COPD is and how to treat it at home, how to manage that disease at home. They also develop a COPD caregiver toolkit. So this resource helps the patients and the healthcare provider obtain information about the patient management while living with COPD, prevention, treatment of COPD at home, and COPD action plan to avoid exacerbation, which is pretty much what I was just mentioning right now. So this caregiver's toolkit, it's important, right? Because every patient might have a different severity of COPD. So one of the things that for you to be able to diagnose a patient with COPD, you need something called a pulmonary function test. So for you to be able to diagnose patients with COPD, or for them to be treated for this disease, they need to have this exam done. So there's actually a high amount of our patients that come into the hospital that were smokers in the past, that they smoke for 20, 30 years and they still smoke to the day, but they have never had done a pulmonary function test. So the problem with this is that because we don't have the severity of their disease, which the pulmonary function test will tell us the severity of the disease based on a percentage, because we don't have this data, sometimes it's really hard for us to treat these patients and have an appropriate action plan for them, because we might be treating these patients with usually what we do, right? We do albuterol and Atrovent, which both of those medications actually improve symptoms like wheezing, like increased work breathing, all the symptoms that we'll be looking on these patients. Both, we got albuterol, which is a bronchodilator, and we also we have Atrovent, which is a muscarinic agent, right? So both of these medications have different pharmacokinetics and different pharmacodynamics that come into factor. But in the end, we might not know if this patient might need steroids at the time, or what happens if this patient is actually having a viral infection on top of their exacerbation that could be causing the COPD symptoms to be worse than what they're having right now. So it is really important that COPD patients or patients that have smoked in the past have a pulmonary function test, so for healthcare givers we can provide the right treatment for them. All right, so right now we'll be talking about the Respiratory Health Association and pretty much their role. pretty much their role. So they have pretty much advocate for helping find like diagnosis of any kind of like lung disease pretty much. So, and they're pretty much like a leader, right? They're a leader for advocating for those patients that were diagnosed with any kind of like lung disease. And I include all of like lung diseases at this point, right? I'm also including cancer, I'm including asthma, interstitial lung disease. I know these are like a lot of like big words for you guys, but these are just like different like lung disease that we will see currently